Hello, guys. Welcome to Podcast Met. In this audio podcast, I'm going to be talking about signs of pregnancy and investigations during the pregnancy. Coming to the signs of pregnancy, we divide the signs of pregnancy into three. Basically, firstly, it is presumptive signs, probable signs, and diagnostic signs. Presumptive signs are the signs or symptoms observed by the patient or the mother herself. That is, as we discussed, all the symptoms that trimester wise complaints by the mother, all of those comes under this presumptive signs. Coming to the probable signs, these are the signs observed by the doctor on examination. So coming to this, there are these signs: Goodell sign, Piscasex sign, Osiander sign, Chadwick sign or Jacquemer sign, Palmer sign, Hager's sign. Coming to the Goodell sign, it is cervical softening. It is the sign where there is softening of cervix at the age of gestational age of 6 weeks. Coming to the Piscasex sign, it is observed at 8 weeks of pregnancy, and it is the irregular uterine enlargement due to one-sided implantation of the fetus. This is Piscasex sign. Coming to the Osiander sign, there is on pervaginal examination, there is pulsations of uterine vessels felt in the fornices, anterior, posterior, and lateral fornices, because fornices have arteries and veins there. So this is Osiander sign. Coming to the Chadwick sign or Jacquemer sign, this is bluish discoloration of the vagina because of increased vascularity of vagina during the pregnancy. Coming to the Palmer sign, it is the same, uterine contractions. The other signs are Braxton Hicks contractions, which are false contractions, which might not be felt by the patient herself, and it is irregular spasmodic contractions. And then there can be chloasma, facial chloasma seen, pigmentation around the eyes, cheeks, etc. And there is stria gravidarum, which is a skin pigmented line from the xiphi-sternum to pubic symphysis. And stria albicans. Stria albicans is the white-colored line that is left after the pregnancy, basically. And these stria albicans is formed from the linea nigra, that is dark pigmented lines below the umbilicus. Then we can see respiratory discomfort after the 36 weeks of pregnancy, etc. All of these are the signs of pregnancy. And third category is diagnostic signs. Diagnostic signs are compulsory diagnosis, like confirmed diagnosis of it, like gestational yolk sac, gestational sac seen under USG abdomen pelvis, cardiac activity observed by fetal Doppler, fetal activity, fetal movements. All of these comes under diagnostic methods. Then after this, coming to the investigations during the pregnancy in the first trimester, we'll be seeing for complete blood picture, hemoglobin levels, blood glucose monitoring, blood grouping, complete urine examination, urine culture and sensitivity. If should be seen for any asymptomatic bacteriuria, that is more than 10 power 5 bacilli in the urine. Then liver function tests, renal function test, thyroid function test. This is thyroid function test is very important for hyperemesis cavitarum, because it can be happening in the cases of hyperthyroidism. And then viral markers like BDRL, HIV, HPV, hepatitis B, BDRF, sorry. Then coming to other investigations, this UPT, urinary pregnancy test, is basically the test for HCG levels in the body that a female by herself may do to diagnose her pregnancy. And basically after this, most of the females come to the OPD for pregnancy checkups. This UPT will be positive within 8 to 9 days after fertilization normally, and even before missed period. We can actually see the pregnancy positivity in UPT, that is urinary pregnancy test. And coming to the second trimester investigations, We'll do all the above, plus we'll also do oral glucose tolerance test, and also RH incompatibility test here, Combs test. In third trimester, all the above. All the first, second, third trimester are as follows. And then coming to the scans done in the pregnancy, first trimester we'll do early growth scan, and which will give scanned EDD. EDD is expected delivery date, which will give assessment of gestational sac, yolk sac, cardiac activity, fetal pole. It is also called dating scale basically. Okay, then we'll be doing nuchal translucency scan, NT scan, which will see for a fluid at the back of neck. If it is more than 3 mm, there can be chances of Downs or cystic hygromas. It is done at 11 to 13 weeks of pregnancy, and early growth scan or dating scan is done at the gestational age of 6 weeks. Then in the second trimester we'll do TIFA scan. What is TIFA scan? TIFA is targeted imaging for fetal anomalies. We'll be checking for any fetal anomalies here. It is done at the age of 18 to 20 weeks of gestation. And then coming to the third trimester, we have two scans here: non-stress test, which is done at 32 weeks, and a growth scan, which is done at 32 weeks again. Then if these are non-stress tests, if it is positive, we'll go for biophysical profile. Then after scans, we have screening tests. First trimester, the screen, not trimester wise, just the screening tests that are done in the pregnancy, or double marker test firstly, or dual test it is called. It is done at the gestational age of 11 to 13 weeks. It will look for any Down syndrome, Patau syndrome, or Edwards syndrome. Basically, it will look for two markers. What are those two? Is PA, Papa, pregnancy associated plasma protein A, and HCG beta HCG. These two, based on these two marker levels, will be ruling out Downs, Patau, and Edwards. In Downs, both of the HCG levels increases. In Patau and Edward, HCG level decreases. Okay, then PA, Papa marker that decreases in all the three. So based on this, we'll confirm the positivity for any of these syndromes and go for NT scan, and then we'll go for fetal heart echo, and then we can go for karyotyping after this as well. And we'll also do chorionic villus sampling, amniocentesis in the first trimester for ruling out all these abnormalities. And the other test that is done is triple marker. We'll use three markers here, that is alpha fetoprotein, estriol, and beta HCG. It is alpha fetoprotein, alpha fetoprotein and estriol will decrease in Down syndrome, and beta HCG is increased in Down syndrome. This is mainly for Down syndrome that we use it. It is done at the age of 16 to 18 weeks of 18 to 20, like 16 to 18 or 20 weeks of gestation it is done. So these are the screening tests that we do. And one more thing I want to say here is dating scan can be giving the assessment, like give the information about gestational age, singleton multiple gestation, life ongoing pregnancy or missed abortion, if there is intrauterine or ectopic pregnancy. It can also give an idea about gynecological pathologies like fibroids, Mullerian duct abnormalities, etc. All of these are the signs and investigations of pregnancy. Signs, investigation, scans, and screening tests done during the pregnancy.